Welcome back to East Texas Live on KTK. Well, joining us now is Stephanie from Mother Frances ContinueCARE Hospital. She's here to tell us a little bit about the award they just won. Welcome,
Yes.
Stephanie.
Thank you.
Okay, so yeah, explain this award to us.
This is an award that is taken from the physician's point of view. It's a satisfaction survey that's filled out by the physicians that provide care at ContinueCARE, and it's looking at how do they view administration, how do they view the communication between administration and the patient. Do they have the tools that they need to do their job? Do we make it easy for them to communicate with the patient and provide that open communication both with administration and the clinical staff.
And how many people are up for this award?
Probably, this award was granted to us from Healthstream, which is a national company that measures satisfaction of healthcare facilities. And probably in the 100 beds and below is the award that we won. And there'd probably be several hundred that would be in that category.
Well, and it's interesting because we were talking about it's usually from the patient's perspective and not the physicians. I mean, what do you think they're looking for to be satisfied, to have the overall satisfaction?
I think the most important thing, both for the patient and for the physician, is open communication and making sure that as there are new processes that change within the hospital, that we're communicating that to the physician. They have a very fast-paced schedule, and if we have a barrier there in order for them to communicate, then that slows them down, and they need to keep moving.
The open line of communication.
So it's really the communication, I think, and studies have shown that if physicians are satisfied, patients are satisfied, because they want that communication. They want the information, say for example, a test result. They want that test result to be available to them when they go in to talk with the patient about it. And if as a hospital we're not providing that, then that's a barrier for them to provide good care to the patient.
I was going to say, no one wants to be in the dark.
Yes, absolutely, and especially in medicine. You do not want to be practicing in the dark. So it's very important to have that communication. The camaraderie, I think, with the clinical staff and the physician, I think, is important, because then that just filters back to the patient, which is ultimately the most important thing.
And how important is it to you all that you have received this award? Why is this so important?
It is so important. This is actually our second year to receive it.
Okay.
So we're really excited about it. You know, there are lots of changes within the physician communication. So it's important for me as the administrator to know that we are providing the physician with the tools to take care of that patient, because there's so much. The patients that are at ContinueCARE need to be there for a length of stay greater than 25 days.
Okay.
So that means they're a very sick patient. They have a lot of things going on. And so it's very important for us. It really shows great teamwork, really shows a good partnership with that physician and that clinical team.
Thank you. Congrats.
Yes, thank you so much. I appreciate it.
We'll be right back. Stay with us.